All right, all right. Yes, yes, yes. Please let me know. All right. All right. Okay, so yes, now I can see myself on YouTube. So can we start कर सकते हैं? All right. So yes, so first and foremost, boys and girls, I would like to tell all of you that ours is a DAMS-eMedicoz official Telegram group where all our faculties are available 24/7 for you, and you can post any of your queries. We are constantly posting our quizzes, we are constantly posting our MCQs of different subjects at different times, so you can always be a part of it and participate. And I am really glad to tell you that we are also doing a mini test and discussion series on eMedicoz app, which is absolutely free of cost for all of you, right? And you can enroll from your eMedicoz app, and you can see our 25 MCQs discussion. But please attempt the test first. ENT has happened, ophthalmology has happened, micro happened just 10 minutes back. So next class will be that of orthopedics as per the tentative schedule. But I would suggest you to go through the schedule on your mini TND calendar, and you can easily enroll and follow it, है ना? So I am writing, so you can follow us on Telegram on DAMS-eMedicoz official Telegram group. You can also follow me if you want to. So that is Ophthalmology by Dr. Manish Chhabra. Please, 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 you can also follow, please follow another two important Telegram groups. Obs Gynae consisted of a major chunk in your FMGE July 2024 examination. So OBGY by Dr. Deepti Behel. So you will be staying connected. You will be staying connected with all our faculties with the important subjects, and then also a group of radiology by Dr. Sumer Sethi. So you can follow us. You can also follow us on Instagram. So you can follow us on Instagram, Deepti_Behel, Sumer Doc, I_Manish. These are our handles. damsdelhi is also our handle, so you can follow us, right? Okay, so where we keep on doing quizzes, we keep on posting questions, we keep on posting images, ophthalmology images, obs gynae images, radiology images, overall images on DAMS-delhi YouTube channel, dermatology images, orthopedic images. So we keep on doing that, so it will be a fun. All right. So thank you छोटा डॉक्टर. So बस एग्जाम का रिजल्ट आने दो, फिर आप बड़ा डॉक्टर बन जाओगे, है ना? ओके, great. So my best wishes. Thank you very much for all the appreciation that I have got in past, should I say, 24 hours, especially after appearing, after you guys appeared for your FMG exam. I am glad that we as DAMS were of help to you in your this journey. Now we are really waiting for your results and then we'll party. और जैसा मैंने all the best message में बोला था, पार्टी करेंगे जरूर. दिल्ली में करेंगे या चंडीगढ़ में करेंगे, वो डिसाइड करोगे आप. अगर चंडीगढ़ में करना है तो आ जाओ, मेरे घर आओ, मेरी ओपीडी में आओ, जहां आने आओ. दिल्ली में करना है तो मुझे बता दो अपना एड्रेस, मैं आ जाऊंगा. जहां बुलाओगे वहां आ जाऊंगा. डोंट वरी. ऑल राइट, चलो. So let's start with the very first question. Sudden loss of vision with no fundal glow. There is no history of trauma. अब समझें, What is fundal glow? Fundal glow is when you throw the light in the retina, it strikes the retina and it is received back. What if there is any opacity which lies in between the light and the retina, boys and girls? So out of the given options, even if you are not aware of anything, you can mark it. So the answer is vitreous hemorrhage. In vitreous hemorrhage, because there is blood in the vitreous cavity, so it will not allow the red glow of the fundus to pass through it. So sudden loss of vision with no fundal glow, typical history, and of course there is no history of trauma, right? So the answer will be your vitreous hemorrhage. अब मुझे बताइए कितने लोगों का ठीक है ये? How many students have got this question correct? I am sure many of you students, most of you students would have done it correct. We had done it in the class, right? If there is blood, if there is the hazy media is there, so it will not allow the red reflex of the retina to pass through it. Yes. All right. Very good. Very good. Very good. Very good. Okay. Now, optic atrophy. Optic atrophy, even of course in optic atrophy the patient will not be able to see, loss of vision will be there, but retina is normal, na? Just that the retinal, you know, sorry, the phone came. Okay, just that when the retina is stimulated and the impulse which goes from ganglion cells to the optic nerve, right? And because there is damage to the optic nerve, the impulse is not able to go into the occipital lobe, right? So that is why the patient is not able to see, but the retina is all right. So the fundal glow will be present. Acute anterior uveitis, yes, the retina is all right. We are talking of anterior uveitis. Anterior uveitis is inflammation of the iris and pars pliccata of ciliary body. The other name of anterior uveitis is iridocyclitis. So fundal glow will be there. Angle closure glaucoma, sudden raised intraocular pressure, which will lead to IOP from 15 millimeter to 60 millimeter of mercury in just 30 minutes. There may be corneal edema, but again, the red reflex will be there. The red reflex will be there. All right. So the answer is vitreous hemorrhage. I am dissecting each and every option one by one so that the students who are yet to appear for December FMGE exam, they also get knowledge. The idea of conducting these sessions is not that we want to come forward and say, okay, this you have got correct, this you have got wrong, okay, done, you can calculate your marks. That is not our idea. Our idea is to give you the orientation, to teach you something out of this 30-40 minute session so that next time you don't commit a mistake. When next time? Of course, FMGE exam you are going to pass anyway. There is a paradigm shift from the routine single liners to clinical question. This is one such clinical question. What if the same question gets repeated in NEET PG? You should be able to get it correct now. What if the same question is repeated in INICET? You should be able to get it correct now. That is our idea, right? All right. So pay attention to the minute details that we are discussing. Okay. Again, sudden painful loss of vision with mid-dilated and fixed pupil. This is a picture of one disease. Of course, optic neuritis, there will be sudden loss of vision, है ना? Sudden loss of vision. The pupil will be it may be dilated and fixed. Why? Because the afferent of the optic nerve is damaged. So pupil may be dilated. But we are talking of painful loss of vision. In optic neuritis, boys and girls, it is painless. Of course, in retrobulbar neuritis, you know na, optic neuritis, there can be papillitis, which is inflammation of the intraocular portion of the optic nerve. There can be retrobulbar neuritis, in which there be inflammation of the intraorbital part of the optic nerve. And you know that if the patient is having retrobulbar neuritis and the patient comes to the doctor and will say, Doc Saab, I cannot see anything. And the doctor will ask the patient to calm down. And doctor will take the ophthalmoscope or maybe do a slit lamp biomicroscopy and will examine the fundus of the patient, and the doctor will say, patient, I also cannot see anything. What does that mean? That means that because there is retrobulbar neuritis, the optic nerve head will be normal. The fundus is also normal in optic neuritis, है ना? So doctor cannot see anything means no abnormality in the fundus, the optic nerve head, the optic disc. But the patient cannot see anything because of course the optic nerve is inflamed. There is retrobulbar neuritis, right? So, but there is pain on elevation in retrobulbar neuritis, but in papillitis, optic neuritis, which is papillitis is a type of optic neuritis, right? There is no pain overall. So this option can be ruled out. Cataract, sudden painless loss of vision, no. Sudden painful loss of vision, no. Cataract is gradual progressive painless loss of vision, but it has nothing to do with mid-dilated and fixed pupil unless there is phacomorphic glaucoma. Got it? Okay. Macular degeneration, no. Macular degeneration is also gradually progressive loss of vision. Is it understandable? So the answer is acute congestive glaucoma, boys and girls. I hope it is clear. History of intake of ATT with loss of vision, anti-tubercular therapy. Most probable drug is, now boys and girls, so there were two options. One is isoniazid, another is ethambutol. So ethambutol has the ability to cause central scotoma, centrocecal scotoma. Isoniazid has the tendency to cause optic neuritis at times, retrobulbar neuritis. Optic neuritis, you know, retrobulbar neuritis, papillitis, neuroretinitis. So retrobulbar neuritis, there are few cases which has been detected. But ethambutol, so basically it is a part of toxic optic neuropathy. Toxic optic neuropathy. There are other causes of toxic optic neuropathy. Which is that cause? Ethambutol, amiodarone, digoxin, chloroquine, right? So these are quinine. These are the drugs that can cause toxic optic neuropathy. Tobacco, alcohol. So, all right. So, yes, absolutely correct. So, Chhota doctor is saying there was also loss of color vision. Also, you will go for ethambutol, which is absolutely correct. 3 cheers, Chhota doctor. So far, all 3 questions are correct. Great. Your all 3 questions are correct. I'm so proud of you. Okay. Now, next question is vitamin A deficiency is seen in. I always tell my students to go through the WHO classification of xerophthalmia. And do you know, previously it was asked X1B is of course a stage of xerophthalmia as per WHO. And what do you see in X1B stage? I always say B for Bitot spots. So ये Bitot spots से इनको बहुत प्यार है, घूम फिर के Bitot spots कहीं ना कहीं से डाल ही देते. तो vitamin A deficiency is seen in Bitot spots, which is a sign of conjunctival xerosis. And I always tell my students that what is the treatment of vitamin A deficiency? 0, 1 and 14 days पर आप क्या देंगे? You will give vitamin A palmitate. Vitamin A palmitate. But if the age of the child is less than 6 months, you go for 50,000 international unit. If it is 6 months to 12 months, you go for 1 lakh international unit. If it is more than 1 year or 12 months, so you go for 2 lakh international unit. But mind you, my dear boys and girls, I am talking of oral administration. ये कौन सी administration है जी? This is your oral administration. Now, if you will give intravenous, the bioavailability will be more. So you need to decrease the dose. You for IV, you go for oral by 2. IM, you go for oral by 2. Systemic अगर आप दोगे तो आपको oral by 2 करना पड़ेगा. Yes, all right, very good. And do you know what is pinguicula? Pinguicula is a precursor of pterygium. Pinguicula is a triangular patch which is whitish yellowish in color. Some books mention that it is a precursor of pterygium. Pterygium is elastotic degeneration of conjunctiva, है ना? And This pinguicula, pinguis means, what does this pinguis means? Pinguis means fat, which is a misnomer. It does not contain fat. Pterygium, you know, it is elastotic degeneration. What is Stocker's line, my dear friends? Stocker's line is iron deposition on corneal epithelium. Iron deposition where? On corneal epithelium. It is seen in pterygium. It is seen in pterygium. I hope it is understandable. All right. Okay. We have dissected all the options. Okay. Visual acuity of the right eye is 6/36. What do you understand by 6/36? 6/36 means that the patient is able to read 6/36 letter from a distance of 6 meters, which a normal person can read from a distance of 36 meters. Right? I hope you know that. Difference in refractive power of two eyes is, so in one eye it is +5 diopter, in another eye is +1 diopter. So there's a substantial difference between the right eye and the left eye. So this you call what? You call anisometropia. If you could recall, we had done this in PYQ ka BAP. So it is anisometropia, right? Now, if there is anisometropia, I had told you it is the most common cause of amblyopia. Amblyopia is stimulus deprivation, loss of vision. What are the other causes of amblyopia? Congenital cataract, high refractive error, mechanical cause may be drooping of the eyelid, strabismus or squint. What is the treatment of amblyopia? Refractive error correction with the patching of the eye. Patching of which eye? Patching of normal eye. So here, what is your diagnosis? So diagnosis is anisometropic amblyopia, because even after the application of +5 diopter, the vision is still 6/36. So there is no improvement. And Dr. Pradeep Ravi, anisometropia was not in the option even if it is amblyopia, because the visual acuity after putting the glasses is 6/36, which is not improving, because you can see that there is high refractive error between two eyes, right, which is anisometropia. So you can still go for amblyopia. ठीक है जी, done? समझ आ गया? Okay, and dear Chota doctor, it's fine. Left eye, if it is 6/6, right eye 6/36, na? So that means right eye is not improving even on application of glasses, hai na? If it is not improving, so out of the given option, what is that? So that is amblyopia. If it is refractive error, it should improve, na? So it should get 6/6. If it is not improving to 6/6, boss, that means there is something else apart from only being refractive error. So there is amblyopia. Yes, very good, very good. You have done it correct. Very good. So proud of you. So there was another question, history of blunt trauma, and some students told me that there was an image which was shown like this, and that was an image of a cataract, which is your rosette cataract. Rosette cataract, जब हमारी discussion हो रही थी तब भी मैंने बताया था, rosette cataract is actually seen in blunt trauma. And can you all tell me rosette cataract is which type of cataract, boys and girls? So this is your posterior cortical cataract. Don't confuse it with that of your anterior cortical cataract. Anterior cortical cataract is seen in your penetrating injury. Why penetrating injury? Because when the foreign body will hit the cornea, it will pierce the cornea and it will hit the lens where it is going to get lodged. It is going to get lodged, piercing the anterior part of the lens, and that is cortex, my dear friends. So anterior cortical is seen in penetrating injury. If the penetrating injury, the intraocular foreign body is that of copper, it will cause sunflower cataract. Don't forget, even in Wilson's disease, there is deranged copper metabolism. It will lead to your sunflower cataract. समझ में आया? And Christmas tree cataract, boys and girls, it is seen in myotonic dystrophy. Myotonic dystrophy. कॉम्प्लिकेटेड कैटरैक्ट इज रिलेटेड टू द अदर डिजीजेस ऑफ द आई, जैसे कि रेटिनाइटिस पिगमेंटोजा, हाई मायोपिया, ग्लॉकोमा, यूवियाइटिस. ठीक है जी, uveitis. So this is your complicated cataract. चलो, I am not writing but still I want to say because this is also your previous year question, NEET PG का क्वेश्चन है. तो मैं चाहता हूं अब आप लोगों का FMG तो क्लियर हो गया, मैं मान रहा हूं आप सबका क्लियर हो गया, तो आप NEET PG के लिए क्लियर करेंगे. इन कॉम्प्लिकेटेड कैटरेक्ट देयर आर टिपिकली ब्रेड क्रम्ब opacities. It is most commonly posterior subcapsular cataract. There is polychromatism. Polychromatism means polychromatic luster. When you will examine the patient on a slit lamp, you will throw the slit beam, it is going to strike the breadcrumb opacity and the light is going to diffract, reflect and refract. So it will give some sort of a rainbow appearance. समझ पा रहे हैं? That is why you say polychromatic luster is seen, and there is axial spread of the opacity from posterior to anterior, anterior-posterior axis. Axial spread of opacity is there, right? So these were some few important points that I think you all should be aware of. Okay, all right. Now there is a history of ear surgery after which the patient had developed legophthalmos. Legophthalmos, you know, inability to close the eye. Can you tell me which muscle helps in closing of the eye? Please don't say levator palpebrae superioris, because that is not the muscle which is involved. The muscle which is involved is your orbicularis oculi. Orbicularis oculi. But boys and girls, you are already yes, very good, chota doctor. So it is 7th cranial nerve, and if the patient is having legophthalmos, when the patient will sleep, the eye will be exposed to the external environment, which will cause neurotrophic keratitis. So the answer is 7th cranial nerve. I hope all of you got it correct. Great. Okay, curtain falling sign is seen in. Now what happens in retinal detachment? There is sudden painless loss of vision. So the patient usually comes to the doctor and say, doctor साहब ऐसा लगा जैसे आंख के सामने पर्दा आ गया. I always say this, है ना? So the answer is retinal detachment. Curtain fall. Remember curtain falling sign. उसके बाद photopsia. Photopsia means flashes of light. There is convex configuration of the retina. There is leukocoria. है ना? So these are the things that we usually discuss during the class, right? So the answer to this question is retinal detachment. है ना? So this curtain falling sign means sudden loss of vision. Sudden loss of vision. All right. Sudden loss of vision. All right. Now, which of the following is a local anesthetic? इसमें I always and always show you one surgery. एक बार मैं दिखा देता हूं. जब तक सर्जरीज ना दिखाऊं, जब तक आपको अपने साथ ओपीडी या ओटी में ना लेके जाऊं, कुछ मजा सा नहीं आता. अभी तक कोई एक सर्जरी नहीं देखी. चलो एक सर्जरी देख लेते हैं. ये देखो, ये सर्जरी मैं हमेशा अपनी क्लास में दिखाता हूं और मैं बोलता हूं, क्या बोलता हूं? बता दो ये कौन सी सर्जरी, कौन सी कैटरेक्ट सर्जरी है? बताओ ये मैं क्या कर रहा हूं? I am giving a local anesthetic, and I always say in my class, this is the local anesthetic which you give before performing cataract surgery or any intraocular surgeries, right? ये आप देते हो. So what is the name of this? The name of this drug is lignocaine, lidocaine, xylocaine. Lidocaine, xylocaine. All right. So this drug is your lignocaine. Don't worry. Still you have done pretty well. Don't worry. You will cover this up. Don't worry. So the answer is lignocaine, and bupivacaine is available in the percentage of 0.75%. Proparacaine is used in topical anesthetic. I always tell you that nowadays cataract surgery can even be performed with a drop of local anesthetic on the eye. That I also show to you. The proparacaine bottle, if you could remember, while doing staining of the cornea, while doing which A scan, you remember, biometry, part of biometry, I show you na proparacaine. I also show you short stonometry. Any procedure in which you need to touch the cornea, you put proparacaine. You need proparacaine because that is a topical anesthetic agent. Dear Abhijit Chaudhary, we are giving this block in the middle part of superior orbital fissure. What are the structures that pass through the middle part of superior orbital fissure? It is nasociliary nerve, oculomotor nerve, abducent nerve. But another important point that I tell in the class is that since the nerve supply of the superior oblique muscle lies in the superior part of superior orbital fissure, in which we are not giving any lignocaine, so superior oblique escapes retrobulbar block. Right? Very good, Dr. Rahul. Very good, very good. Very good. Dear Vibhor, it depends on the question. Local anesthetic, if that was in the option, you'll go for lignocaine. Topical anesthetic, topical is proparacaine. Topical is proparacaine. Thank you very much. Topical is proparacaine. Vibhor, is it clear, buddy? Dr. Pradeepa, yes. If that was a question with history of chemical injury, this is the most common and most lovable question of INICET and NEET PG exam takers. Why? Because they usually give in the history that the patient had tuna gone in his eyes. What will be your next step? So one was slit lamp examination. Second was you will go for copious irrigation. अब आंख में अगर चूना पड़ गया है and you know it can cause a chemical reaction, so the earliest thing to do will be to do copious irrigation. ना आंख में कुछ पड़ जाए, आपकी आंख में कुछ मिट्टी पड़ जाए, आप शीशे के सामने खड़े होके पहले देखते थोड़ी ना हो, लोकेट थोड़ी ना करते हो, आप सीधा जाते हो और आंखों पे छींटे मारते हो, उसके बाद आप देखते हो कि कुछ रहा है कि नहीं रहा है. डू यू गेट माई पॉइंट? राइट? Do you get my point? I hope you have got my point. All right, all right. Which of the following is corrected refractory error? So एक ऐसी कुछ image थी, तो ये थोड़ी सी confusion थी, बस इतना समझ लीजिए. If the image is being formed in front of the retina, it is myopia. So this is which glass? This is your divergent glass. This is your divergent glass, which is used in myopia. This is your convergent glass, which is used in hypermetropia, right? Hypermetropia, but yes, and यहाँ पे you will go for, यहाँ पे देखो the image is tilted, तो यहाँ पे you will go for cylindrical glass. Dear Dr. Rahul, lignocaine, lidocaine and xylocaine, yes, they all three are same. All three are same. ठीक है जी? Okay. Now cherry red spot is seen in. Now this is a slightly tricky question. Now I always tell that there is a mnemonic. So cherry red spots are seen in central retinal arterial occlusion, Tay-Sachs disease, Niemann-Pick disease, Gaucher disease, GM1 gangliosidosis, trauma is your Berlin's edema. Trauma is your Berlin edema. Then metachromatic leukodystrophy. Then Sandoff disease. Sandoff disease. So the answer will be here Tay-Sachs disease, because Tay-Sachs disease is the most common lipid storage, most common disorder that causes cherry red spot. Is it understandable? Is it understandable? Out of the given options, Tay-Sachs is to be marked. Tay-Sachs is to be marked. All right. Okay. All right. Now coming over to the normal flora. This question I believe was slightly tricky because some books mentioned that Gaucher disease and Tay-Sachs they equally cause cherry red spot, but some books mention no, Gaucher disease, the cherry red spot is not true spot, it is a pseudo spot. So it is kind of integrated question with that of biochemistry. So I believe this was a slightly tricky question, right? But the answer is Tay-Sachs. Out of these two, Tay-Sachs has to be marked because that is relatively common, right? Okay. Now normal flora of conjunctiva. Normal flora. देखो मैं हमेशा एक चीज बोलता हूं, if you could recall, I had told you that post-operative endophthalmitis, what is the best treatment? The best treatment is to put povidone iodine 5% on the eyelashes. Why? To kill the normal bacteria commensals which are present on the eyelashes. What is the most common cause of post-operative endophthalmitis? Staph epidermidis. So this is how you need to connect the dots. So because that is normally present, if staph epidermidis is not in the option, then you will go on for staph aureus. Staph aureus. All right, staph aureus. If staph epidermidis is not in the option. Okay, what is the definition of blindness as per WHO? देखो, one criteria is low vision, which is vision 6/60. एक criteria है low vision का. Low vision if it is 6/60 to 6/18. Then economic blindness, ये बार बार आ चुका है क्वेश्चन. Economic blindness criteria is when the vision is 6/60 to 3/60. Right? Then social blindness, vision is 3/60 to 1/60. Right? Then manifest blindness, if the vision is less than 1/60. Then absolute blindness. Absolute blindness when the vision is perception of light absent. This is another criteria. इस पे बार बार जो आपका क्वेश्चन आता है वो आता है सोशल ब्लाइंडनेस पे. इस बार इन्होंने एक जनरल ब्लाइंडनेस पे क्वेश्चन दे दिया है. सो द विजन इज लेस देन 3/60, less than equal to 3/60, and it should be BCVA, best corrected visual acuity in the better eye. Best corrected visual acuity in the better eye. That is the definition. Or another is if the visual field is less than 10 degree. If the visual field is less than 10 degree, it is as per WHO. As per NPCB आज भी यही है, the same. बट आज से अगर 5 साल पहले की बात करें तो एज पर एनपीसीबी द ब्लाइंडनेस क्राइटेरिया was आई एम नॉट सेइंग इज, द क्राइटेरिया was, मैं लिख रहा हूं was, क्राइटेरिया was लेस देन इक्वल टू 6/60, नॉट 3/60, 6/60 प्रीवियसली तो इट was. बट अब एनपीसीबी का इज क्या है? एनपीसीबी का इज क्या है? इज 3/60. आप बोलोगे सर फिर तो ये सेम हो गया. अभी भी ये सेम नहीं है. 3/60 विद अवेलेबल करेक्शन, नॉट बेस्ट करेक्टेड. बेस्ट करेक्टेड का मतलब तो ये हुआ ना, आपने पेशेंट को स्पेक्टिकल्स दे दी. अवेलेबल करेक्शन, अवेलेबल करेक्शन मतलब पेशेंट की विजन ली कितनी है? 6/60. ठीक है, पेशेंट देख पा रहा है. उसके बाद आप उसके बियॉन्ड नहीं देख पा रहा. 6/36 नहीं है, 6/24 नहीं है, 6/18 नहीं है, 12 नहीं है, 6/60 पेशेंट देख पा रहा है. राइट? तो ये था पुराना क्राइटेरिया. आप बोल दोगे ब्लाइंड विद बेस्ट करेक्टेड है ना. लेकिन अब WHO बोलता है कि इट इज लेस देन और इक्वल टू 3/60. ऑफ कोर्स एक आंख बंद करोगे ना आप, लेस देन इक्वल टू 3. इंडिविजुअल दोनों आईज की चेक करोगे. हमेशा जब भी विजन चेक करते हैं दोनों आईज की इंडिविजुअली चेक करते हैं. बट जब आप ब्लाइंडनेस के लिए बोलोगे तो दोनों आंखों के साथ बेस्ट कर, जोन सी बेटर आई होगी ना उसमें आप बेस्ट विजन चेक करोगे. इफ इट इज लेस देन 3/60 और इक्वल टू 3/60 विद ग्लासेस, देन यू विल गो ऑन फॉर WHO. आप समझेंगे कि WHO क्लासिफिकेशन है. इफ बेटर आई 3/60 और लेस विद अवेलेबल करेक्शन, तो वो हो गया एनपीसीबी का क्राइटेरिया। ये करंट है, करंट, बट आज से पहले 5 साल पहले कितना था? 3/60 एनपीसीबी का नहीं था, एनपीसीबी का था 6/60। तो तीनों चीजें मैंने आपको बता दी हैं। यस, तो छोटा डॉक्टर, यस, एज पर द करंट गाइडलाइंस WHO लेस देन 3/60 इन बेटर आई विद बेस्ट करेक्शन, राइट? I hope it is understandable. Okay. Was there any image of oil drop? And Dr. Nitya, it is actually very funny. Available correction means, now suppose I am sitting in a peripheral OPD. तो I don't have my refraction box, है ना? मेरे पास refraction box नहीं है, तो मैं तो पेशेंट की विजन इंप्रूव करवा ही नहीं सकता किसी तरीके से, तो वो अवेलेबल है। लेकिन अगर मेरे पास रिफ्लेक्शन बॉक्स पड़ा है और मैंने पेशेंट की विजन इंप्रूव करवा दी, तो पेशेंट ब्लाइंडनेस के क्राइटेरिया से बाहर हो गया। अगर मेरे पास रिफ्लेक्शन बॉक्स नहीं पड़ा, मैं अगर ग्लासेस पेशेंट को नहीं दे सकता, अवेलेबल, जो उस समय पे डॉक्टर के पास ग्लासेस अवेलेबल होंगे, अगर डॉक्टर ने लगा के देखा और पेशेंट इंप्रूव हो गया, तो ब्लाइंडनेस कैटेगरी से बाहर चला गया। अगर वो पेशेंट के पास है ही नहीं, कुछ सामान ही नहीं है, प्राइमरी हेल्थ सेंटर में अगर एक नॉर्मल मेडिकल ऑफिसर चेक कर रहा है विजन और उसके पास कोई जरिया नहीं है रिफ्लेक्टिव ग्लासेस लगाने का, तो तब जो विजन आएगी उसको हम फाइनल ले लेंगे। तो इट इज स्लाइटली कंफ्यूज। यस डॉक्टर नित्या, एब्सोल्युटली, दिस इज व्हाट आई मीन टू से, एब्सोल्युटली। ऑल राइट, सो नेक्स्ट इज योर ऑयल ड्रॉप कैटरेक्ट। सो देयर वाज वन ऑयल ड्रॉप कैटरेक्ट which was asked. If it was there, the answer is galactosemia, and this is the only reversible cataract, only reversible cataract, oil drop cataract. Okay, identify the instrument. ऐसा भी कोई इंस्ट्रूमेंट आया था? हाँ जी, ऐसा कोई इंस्ट्रूमेंट था। दिस इज योर वायर स्पेक्युलम, वायर स्पेक्युलम, बैराक्वर वायर स्पेक्युलम। आर यू एबल टू सी? ऐसा कोई इंस्ट्रूमेंट आया था? प्लीज बताइए। यस, कैन यू कंफर्म मी? यस बॉयज एंड गर्ल्स, so this is your barraquer wire speculum, and this is your Lieberman speculum. It is your Lieberman speculum. इन दोनों में से कोई भी आया था तो आप मार्क कर सकते हो। This is used to open the eye. You want to operate the patient, and of course you would try to open the eye, with the speculum. So this is your barraquer wire speculum. लीबरमैन दोनों में से एक था ना, लीबरमैन नहीं था तो कोई बात नहीं, इसको छोड़ सकते हैं। लेकिन बैराक्वेर वायर स्पेकुलम, इफ इट वाज देयर, बैराक्वेर लिखा भी हो सकता है, नहीं भी हो सकता। अगर वायर स्पेकुलम भी था तो दैट इज द राइट आंसर बॉयज एंड गर्ल्स। ऑल right. So boys and girls, that is it. So this was all about your FMGE July 2024 exam. I hope that you have performed exceptionally well. मुझे पता है कि आप लोगों ने इस एग्जाम के लिए बहुत मेहनत करी थी, और मैं हमेशा अपनी क्लासेस में बोलता हूँ, यू पीपल आर वन ऑफ द मोस्ट हार्ड वर्किंग स्टूडेंट्स। मतलब अभी भी अगर मैं कभी बैठूंगा सुमेर सर के साथ, दीप्ति मैम के साथ, तो वी ऑलवेज एंड ऑलवेज टॉक अबाउट यू गाइज। हम हमेशा यही बात करते हैं कि हमारे जो FMG बच्चे हैं वो बहुत 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 मेहनत करते हैं, एंड वी विल बी रियली हैप्पी to see you scoring really good in your this exam. So I'll be waiting for your messages, I'll be waiting for your calls. मुझे जरूर बताना कैसा आपका स्कोर रहा। I would love to wish you congratulations after seeing your result. मुझे बहुत अच्छा लगेगा आपको congratulate करके, अगर आप मुझे अपना रिजल्ट शेयर करोगे तो इट विल बी माई प्लेजर thank you very much for spending good 40-45 minutes with me. It is always my pleasure to be with my students. And yes, as I told you, do follow us on DAMS-eMedicoz official Telegram channel by Dr. Sumer sir, channel by Dr. Deepti ma'am, channel by myself. If you want to follow, do follow us on Instagram. Let's stay connected and थोड़ी पॉजिटिविटी फैलाते हैं. हर जगह तो नेगेटिविटी हो रही है, कभी कहीं पे पानी घुस रहा है, कभी कुछ हो रहा है, कभी कुछ हो रहा है, कभी कहीं पे तो बारिश ही नहीं हो रही, जहाँ पे बारिश हो रही है वहाँ इतनी ज़्यादा हो जा रही है कि वहाँ पे पानी नहीं कंट्रोल हो रहा. तो इस टाइम पे इट इज़ वेरी इंपॉर्टेंट टू स्टे पॉजिटिव, है ना. एक दूसरे का हाथ पकड़ के चलेंगे एंड इट इज़ ऑल्सो अवर रिस्पॉन्सिबिलिटी. वंस यू विल क्लियर योर FMGE एग्जाम, वी विल होल्ड योर हैंड एंड टेक यू टू द बेस्ट मेडिकल कॉलेज ऑफ द कंट्री इन योर बेस्ट ब्रांच फॉर पोस्ट ग्रेजुएशन. दैट इज माई प्रॉमिस टू यू. हाथ मिलाएं. ओके, ऑल राइट, चलो बाय बाय. लव टू ऑल ऑफ यू. आई सी यू ऑन द अदर साइड ऑफ द रिजल्ट्स. बाय बाय, टेक केयर एंड बेस्ट विशेस.